Balloon induction. Hi, I'm Kathleen, I'm the antenatal ward manager. If you decide to go ahead with induction, there are two different methods we can offer you to start your labour. The method you choose will depend on your preferences, what's happened in your pregnancy, how many weeks you are, and the reason for induction of labour. The first part of the induction of labour process is helping your cervix to soften and open. We assess this by carrying out a vaginal examination. The methods used to start this process fall into two categories, hormonal and non-hormonal. Our non-hormonal method of induction is the cervical ripening balloon. This is the only method used for outpatient induction of labour at present. This is because non-hormonal methods of induction have the least chance of overstimulating the uterus and causing too many contractions. Here is the cervical ripening balloon with two balloons at the end. The balloons are made out of silicone and will sit on either side of the cervix. Each balloon has a maximum inflation volume of 80 ml. Your midwife or doctor will insert the balloon by vaginal examination or speculum. One balloon will be inserted inside of the cervix and will be inflated with 40 ml of sterile saline, which is salt water, and the other balloon will rest on the outer part of your cervix. Your midwife or doctor will inflate each balloon to 80 ml using the sterile saline. The balloons rub against and stretch the cervix, producing a natural hormone called prostaglandin. Prostaglandin causes the cervix to soften and open. This prepares your cervix for labour and allows your midwife or doctor to break your waters. Inserting the balloon can feel a little uncomfortable, however your midwife will support you throughout the process. Following the insertion, you may experience some period-type cramping and backache. This is perfectly normal, and it can be managed well by a warm bath and/or simple analgesia. Sometimes a small amount of the water might be removed from the balloons to help keep you more comfortable throughout the process. The balloon then stays in place for between 12 and 24 hours and will need removing if your waters break. During this time, you may remain fully mobile. If your cervix is opened enough for the balloon to pass through, it may fall out on its own. After 12 hours, the cervical ripening balloon will usually have softened and opened the cervix. However, the balloon may stay in for up to 24 hours prior to you moving to delivery suite for the next stage of your induction. The balloon will continue to help you release prostaglandins during this time. If not before, then at 24 hours the balloon catheter will be removed and we would offer a membrane sweep with the aim to start your contractions while you wait to be transferred to the delivery suite. Approximately 97% of women who choose the balloon method will be suitable to have their waters broken on removal of the balloon. If your cervix is not dilated enough for the balloon to be inserted, or if the balloon does not soften the cervix enough for your waters to be broken, then a plan for you to continue the induction process using an alternative method will be discussed with you if appropriate. In some cases, a caesarean section may be necessary. A doctor will discuss your options with you and your birth partner. Balloon inductions can be offered as outpatient or inpatient appointments. The process for both starts in the hospital, and if you are suitable for an outpatient induction, then you will go home after the balloon has been inserted and then return after 12 to 24 hours. If you are booked for an inpatient induction, you will remain on the antenatal ward during this time. Your options would depend on your reasons for induction, as you may require closer monitoring in hospital throughout the process. You can discuss this with your midwife, doctor and birth partner, and a decision can be made together.